Good afternoon and welcome to this third edition of FDD, and I'm really happy to see most of the familiar faces. On behalf of Ideal Cures, today we have thought of expressing to you about the innovation which we had been carrying out to enrich the pharma world. Pharma formulation development by itself has assumed new dimensions, although we still call we are a generic industry. And looking into what's really happening on the international scene, that from the small molecules, we are moving towards big molecules and biologicals. But believe me, in the 5 decades, the small molecules are there going to stay. Ideal Cure has been the partner for the pharma formulation development for the last 2 decades. And we have won your faith. We have been known very well in the field of pharmaceutical coatings. But if you look at our catalog and our history, we had been innovating a lot and realizing the need of our colleagues on the other side. We have worked hard to offer something which should facilitate their research, their formulation, and reduce their labor. On this particular note, myself and my colleague, Dr. Akshay, will present you the Intraspheres and the spheres which are very commonly known as the pellets. Though it's not a very new thing, we all had been knowing and using sugar pellets for decades. But during our journey and meeting to the pharmacy people, we realized that there's a need to have some more new excipients to be formulated differently, which facilitate the formulation. Besides, that gives an edge for the formulation to be having some innovativeness and patentability. In this direction, today we are going to talk to you about our new venture, what we are really doing in the field of spheres. You will hear 2 terms here, spheres as E-sphere and other one is the Intrasphere. The fundamental difference you will see as we move forward. That's the theme Ideal Cures is working on. Innovation, offering new services and new technologies to facilitate and augment the process of formulation development. We are in the second part, which my colleague Dr. Akshay is going to elaborate. TA stands for tartaric acid, let me tell you. We have been talking about, in fact, Dr. Ramesh was also talking about a lot of things about the basic formulation development for the advanced market or regulated market. And I think it was a good journey for all of us to see how the things really shape up from start, from molecule to market. So the change is something for which somehow many of us, we have immunity. Accepting a change is a very, very difficult thing. It's very difficult to change your mindset. Even while you work on the NDAs and all that, we are very much bound by what the innovator or the brand owner has done. So we are just following a path. And innovation there really would call for a change. So we have to get rid of that immunity and change if we want to innovate. Our talk is going to be focused mainly on spheres from ideal cures, a little bit of background. Although it is stated as a statement of problem, it's not a problem. It is the way we are really going to present our product. About the knowledge and hypothesis which we had in this context. Materials in scope is a normal contention. How did we conclude about the usability and applicability of our product? The ideal requirement for a palette or a sphere is that it should be perfect, round or a sphere, which normally doesn't happen. So the purpose is that it should be robust, smooth, round, consistent with narrow particle size distribution. And these are the aspects which we try to build in our product in order to see that you have the consistency, reproducibility, workability on your product and the process as well as the facilities with which you work. Our material becomes a starting material for you. And in this process, we have tried to help you by cutting down a lot of stages which you might be otherwise doing. So IDCure offers ready-to-use spheres for a variety of applications for pharmaceutical and nutraceutical formulations. E-spheres we have for almost a decade, and you may see that we have listed here the excipients, most commonly used excipients, which are being turned into a sphere, is microcrystalline cellulose, collagen, silicon dioxide, and tartaric acid. You may wonder why not the sugar, which is the most common. Somehow we have not gone into that, for basically some commercial reasons and otherwise. What is the difference between a sphere and intrasphere? If the basic process, if I understand, whatever spheres you make or you buy, first you have to protect them. Otherwise, the spheres are highly friable. They are not solid like rocks. So there's going to be a lot of iteration in the process. There's going to be size variation and all that. Looking into this issue, we thought why not to provide the industry a variation whereby they can cut down their time, they can facilitate, they can reduce the losses and have a wonderful uniform product. So we have come out with the seal coated pallets, the stage which you otherwise have to adopt as the first stage that you're in. We have two types of coatings imparted to the excipient which I talked to you some time back. So water insoluble coating and water soluble coating. Choice is yours. And again, the excipients which we have selected are same, but here the sugar is added because it becomes a premium product, and obviously there is a demand, then we are there to offer this. Along with, we are also given the size ranges. So you can choose what is the right size for you, and sometimes we may get you the requirement for a different size. So looking into the commercial potential and the requirement and all that, we are ready to take those situations as well. So whatever sizes we have talked about, these are readily available spheres. And believe what we are talking about, the consistency, roundness, compactness and all that, that's what you are going to verify when you use it. Yes. Now, if you look around how much the spheres can be used and in what variety of areas and purposes. The main important characteristics, if you look at, we're talking the low friability. That's the most important criteria, but otherwise in the applicability you can use as a diluent, consistency, MUPS. MUPS is the major thing which we are really trying to focus upon. I didn't want to use that term because now that is the term which is very much synonymous with the modified release formulation, and it can be used in any of the areas. Time saving is then the factor which I have included here because it reduces the process time at your end. And you can ask for any of those materials to try it out and see the usability. Next. Some basic specifications which we have laid down here for you to get a feel and idea, because you may have certain requirements about the pH, you may have certain requirements about the bulk density or moisture level. So this slide tells you about what are going to be the common specifications for our spheres, and this is going to be applicable for all the sizes. Friability is one of the factors which we have tried to control, though the limit we are writing here is 1%, but the friability you will find it will be in the range of 0.2 to 0.3% only for the E sphere, and when it comes to an stretch sphere, it's going to be practically nil. Now, I have specifically chosen a detailed study and elaboration on the tartaric acid spheres. Of late, we had a feel from the market and from the companies that they are looking for tartaric acid spheres. I remember for decades, tartaric acid has been used for dipyridamole, Agrinox, the brand product for Boehringer, as an antiplatelet formulation, which is a combination of dipyridamole and aspirin. And we use that model only to prove the sustainability and the usability of our spheres. Though we have not developed the formulation, but we have tried to prove the concept and the product, and everything is before you to try it out as a starting candidate. And as is understood, the tartaric acid spheres have been widely used to act as a promoter solubility enhancer for the weekly basic stress in the alkaline media, and hence impart a prolonged action type of relief and the application. The features you can see: fast, effective, advantages, uniform, uncomplicated, time saving. And now from here, Akshay is going to take it forward. So I have talked more about the art and let him talk about the science. Thank you very much.
Thank you, sir. It has been said that pharmaceutical industry has plucked all low-hanging fruits. What does that mean? It has been said that we do not have drug molecules which are easily developable, formulated easily without any kind of problem. Einstein once said, I remember that, Einstein said that you cannot solve the problems of tomorrow. You cannot solve the problems of tomorrow by the same order of consciousness that we used to create them. So, we have to think for future, we have to look for the problems, we have to find the solutions anticipating the problems. So, with that motive, we have started this presentation with the theme of innovation, and my job has been described as to present the Intrasphere TA as functional starter core for extended release formulations. Now, as sir has rightly said that since it is seal coated, that it shows abrasion resistance and it automatically eliminates the primary step in the coating process. So it saves time, it is cost effective, and above all it has uniform particle size distribution, which makes the coating uniform, and automatically the drug content uniformity will be achievable by this uniformity of the excipient. So I want to talk about a theory or a technology. I won't bore you much, but a lot has been talked about this theory, pH modulation for weakly acidic and weakly basic drugs. These drugs shows pH dependent solubility, as you all are aware, and our stomach pH is also a factor which troubles the drug release, because the stomach pH varies from pH 1 to pH 6, in fed state and fasted state condition. Similarly, intestinal pH also. It varies from 4 to 8. So there is lot of variability of pH inside the body. So what we can do? We have to focus on the drug release and we have to make it as per the specification. So the pH modulation has been in use since I guess 15 years, and the basic theme of this theory is modulation of pH in microenvironment of the drug. What does that mean, microenvironment? Microenvironment means the immediate vicinity around the drug where within the dosage form. Now this doesn't mean we are changing the pH in the dissolution media, no. We are only modulating pH surrounding the drug molecule. But what will happen when the drug is under storage? Because the stability gets affected by pH, as we all know. So there are some questions about this technology, about this theory. Ultimately, we have to improve the dissolution behavior, right? So it has been said that when we modulate the pH surrounding the drug, then the supersaturation degree gets lowered and drug won't get crystallized easily, and so that it can diffuse through the enteric coating or extended release coating material or a coat. So with that theme, there are some questions. It's not as simple as it is shown over here. What are those questions? The most important question is the extent and duration of pH modifying agent. How we can ensure that? Can we measure the pH in the microenvironment of the drug? No, we cannot. There are some alternative methodologies available. One of them is measuring the pH of the slurry. 2% slurry, we have measured that in our specification. And for Intrasphere TA, it comes around 1 pH. So it shows acidic pH. So the important thing or the crux of the matter is the pH modifying agent should last until the drug gets completely dissolved. Okay, there have been a lot of efforts on this particular theory. People have used fumaric acid, citric acid, adipic acid, and they found that, okay, fumaric acid is good. Fumaric acid has a low pKa, so that is one factor. It reduces the pH level to that extent so that acidity can be prevailed for longer period of time. So, then there was another study where they used succinic acid successfully, and it says that succinic acid has low solubility, in fact optimum solubility compared to other acids, and so that it lasts more. So there are certainly two factors which we need to consider when we select the pH modifying agent. First is pKa of that weak acid, and second is the solubility, aqueous solubility. Now in all these studies, and there was another study where 6 organic acids were compared for pH modifying effect, and they said that succinic acid is the best one because it gets retained for a very long period of time. Tartric acid has not been that successful in that scenario in those studies. Why? Because of high aqueous solubility, the tartric acid gets leached very fast out of the pellets. So what does that mean? The tartric acid will not last until the total duration of the drug. And the third thing, which again is important, is the stability. As I have told you, that drug cannot stay in contact with the acid for the longer period of duration and can remain stable. So we have to find solution of all this. Can we use our excipient Intrasphere TA to solve these questions? That's what we tried, and we found a few results for you. So our hypothesis was very simple. We thought that Intrasphere TA will be able to modify the pH in the microenvironment of the drug. That is the first hypothesis. And second hypothesis was, since Intrasphere TA is seal coated, that seal direct contact of the drug and acid. So by that way it can contribute and prevent the degradation of the drug. So this is the aim. We want to describe Intrasphere TA as a pH modifier for extended release drug delivery of weekly basic drug. So these are the materials which we used. As you can see, the drug we selected was dipyridamole. There were some reasons for that. But before that, we used Intrasphere TA as our acid modifier. Instacoat Universal, it is our ready to use HPMC based coating formulation from Ideal Cure. And the third excipient which we used from Ideal Cure was Ecopol S100 acrylate based copolymer for extended release drug delivery. So there were some other ingredients apart from these three. Why we used dipyridamole? Because we were checking the efficiency of our excipient and we wanted a weekly basic drug. Now, dipyridamole shows pH dependent drug release and it shows very less release above pH 5.5. So that is one reason why we selected this drug as a model drug. And secondly, we had a reference product, Agrenox, of the same API molecule. So we wanted to compare the release with that innovator sample. So we conducted the BCS solubility classification and then we confirmed actually that the drug release is pH dependent and so as the plasma variability. So we first selected Intrasphere TA. There were sizes available, but we selected mesh size 2030, which comes around 0.6 to 0.85 millimeter size range. And we again confirmed the specifications, physicochemical parameters, and we conducted the microscopic study. And the results are as shown in this slide. As you can see, the aspect ratio is very high and which indicates good sphericity of our product. So what we conducted in this study, we prepared the extended release pellets in 3 stages. In the first stage, seal coated Intrasphere TA was taken and it was loaded with the drug. So we used FDD with booster column for this purpose. That was the first layer over Intrasphere TA. Since these were seal coated, so we do not have to do any preliminary coating for that. Then the second stage was protective coating by Instacoat Universal. So HPMC based ready to use formulation of Ideal Cure was used just to prevent the abrasion during the coating stage. So a layer which works as a protective coating. And finally, in the third stage, we used extended release coating Ecopol S100. We prepared the pellets and then we evaluated for in vitro drug release stability study and dissolution profile comparison. So this is just a image which gives an idea of how it looked like. Intrasphere TA, innermost layer covered by the dipyridamole drug layer, followed by the Instacoat Universal protective coating, and finally the coating of Ecopol S100. And then we conducted in vitro dissolution study by USP type 1 apparatus at 100 RPM, 37 degrees centigrade temperature. And the basic purpose of doing this study was we wanted to know that whether tartaric acid gets retained over a period of time. And second objective was whether there is a thing like pH modulation, कि सब हवा में बातें करते हैं. So we ensured that by concurrent dissolution measurement of tartaric acid and dipyridamole, and we found that tartaric acid gets retained, though it has high aqueous solubility, it gets retained over a period of 8 hours, and along with concurrently dipyridamole also got released. So it shows that the micro environmental pH was maintained throughout the dissolution study. The first hour dissolution study was conducted in 0.1 normal HCl, and the subsequent time periods were assessed in pH 5.5 phosphate buffer. Now we found so many studies where tartaric acid was actually adsorbed over a sugar pellet and it was used as an acid modifier. Now there are several disadvantages for that, but we wanted to compare both systems. So we compared the sugar pellets layered with tartaric acid with our Intrasphere TA, and we found that which system retains the tartaric acid better. Now here in our system, our product Intrasphere TA, the tartaric acid is present in matrix of a pellet. So it gets retained for a comparatively longer period of time compared to the other. Then we wanted to study the dissolution in absence of pH modifier. So what we did was we conducted dissolution study without pH modulation, and we saw a huge difference in the dissolution profile. So which again confirms our hypothesis that pH modulation is there. The stability study results indicated that the formulation was stable for 6 months during the accelerated stability study, didn't show any significant dissolution changes, and finally then we compared it with Agaranox SR and we found similarity of around 57%. So in nutshell, I wanted to convey that the Intrasphere TA was able to provide acidic microenvironment. It was able to get retained till the dissolution period of the drug, and it was found similar to the Agaranox in terms of dissolution profile comparatively. So the formulation prevents premature drug release and tartaric acid release, increases drug release at higher pH, shows stability over entire duration and similarity of dissolution. So we propose Intrasphere TA as a pH, it is one of the application again, as a pH modifier for weakly basic drugs, extended release. Thank you very much, and with that I conclude my talk, and I will give my mic to sir.
Thank you very much. I'm sure you would appreciate our efforts, and we purposely selected a drug which is very much in use, and you might know it better that somehow diaperidamol is not a molecule which sells very much in India. But today we have, I think, about 10 ANDAs, and the latest was for Glenmark in the month of June itself, 1st or 2nd June. So this is the drug molecule which is available for you if you are keen, but considering that we have proven how this particular material is going to be helpful for this specific category of drugs, you should definitely give a try to that. And we welcome any thoughts, any questions, or any queries on the subject here or elsewhere on any place. Thank you all. Thank you very much.